Hello, I'm here with Dr. Jameson, Pinellas County EMS Medical Director, and Dr. Thogmartin, Pinellas County Medical Examiner. These medical professionals have seen somewhat opposite ends of the spectrum when it comes to the effects of COVID-19 in our local area. So if you have any questions you'd like to ask the doctors, please just put them in the comments below. We will try to answer as many as we can. Good morning, doctors. Thank you for joining us.
Morning.
I want to open it up to both of you first. What's the reality of COVID that you're seeing in your respective areas?
Sure. So, I'm responsible for all the EMTs and paramedics in Pinellas County. And so in that role, we are seeing significant numbers of COVID patients. We are finding them in nursing homes in the community and treating them and taking them into the hospital. And for us, that job is harder than taking care of normal patients because we have to wear lots of protective equipment while we're doing it and take all sorts of precautions. But we continue to see lots and lots of patients with either confirmed COVID or suspected COVID. On the hospital side, we're seeing also significant increases in the number of folks coming for testing and the number of folks that are testing positive. Our hospitals in Pinellas County today have more COVID patients in-house than they've had at any time previously.
Wow.
From my end, we were seeing quite a few referrals for COVID-related deaths that we were investigating. That flattened out with the lockdown, and now we are getting a little increase, although, the spike in numbers that has happened over the past week or so, whatever action you take, there's a delay. So if you have people get exposed during a particular event, then they present clinically, and then the ones that are going to get worse, it takes a while, and then we're starting to see a similar number of referrals to a slightly increased number of referrals for COVID positive decedents, and we're investigating those. What we're seeing as far as the decedents go is amongst the ones we've actually certified, the youngest one in Pinellas is 51, and the youngest one in Pasco is 52. And most all the decedents that we've had, they have comorbidities, and almost probably 85 to 90% of them were in various nursing homes, ALFs, or care homes. So they're the vulnerable population that you have heard about and read about is what we're seeing as far as deaths go. But again, I always tell people that ask me, well, okay, it doesn't hurt young people or kill young people. That less so. However, I think Dr. Jameson could talk about the morbidities that I try to explain. So my role right now is minimized, and we want to keep it that way. I'm hoping to keep it.
Absolutely.
Yeah, that's a great point. We started to see a little bit of a rise in the case counts for younger folks about 3 weeks ago. 2 weeks ago, those numbers started to be much more clear. A week ago, it was very clear that we were seeing a spike in younger folks. And now, as this week has gone along, we're starting to see an increase in the number of people hospitalized and the number of people in the ICU, which just goes to show you that even though the younger folks, for the most part, do relatively well, they're part of the community. And just when you have a spike in young folks, some of whom may not even know they're infected, they can transmit that infection to people who are not going to be as healthy and young and resistant to this. And then we're going to end up with more folks in the hospital, eventually more in the ICU, and unfortunately, eventually more for Dr. Thogmartin.
It seems like from what we've seen that risk factors tend to be, diabetes, obesity, hypertension, heart disease. If you have a relative, even if they're, in their 50s or even younger with these severe diabetics, the younger people, yes, you probably will get through it. Hopefully you'll get through it intact. Hopefully you won't have a stroke or lose a limb. Hopefully you won't go into renal failure. But if you've got a relative that you love that has one of these comorbidities and you contact them while you're asymptomatically or pre-symptomatically shedding, they could get severely ill and die. I mean, the death rate for people above 85 is around, I think we're running 36% or something like that. Pretty significant. That's almost like Marburg or Ebola level of mortality.
Yeah, that was a lot of hopefullys too. So, I mean, hopefully you won't, have any symptoms if you're in the younger age, but hopefully is not a great word to be using when we're talking about COVID.
Yeah, we sometimes say hope is not a strategy. And, there's another good point there, which is that this is a new virus and we're still learning about it every day. And the further we get into this and the more people that have had this disease, the more we learn that there may be long-term effects that we don't really fully understand yet. So I'm sure folks saw some stuff in the news about the inflammatory syndrome in young kids, but that's just one piece of it. We're seeing people who have, significant lung damage after the pneumonia. And so that's going to really change your life if, a year from now, you can't exercise or you need to wear oxygen all the time. We're seeing early reports of neurologic complications that could be long-term. We just, as an aside, we saw that after the 1918 influenza pandemic as well. And, we really don't fully understand this thing. We do know that there's a couple of really important risks, like the virus seems to make your blood more prone to clotting. And so we're seeing people come in with pulmonary emboli or blood clots in the lungs. We've also seen case reports of people presenting with heart attacks and strokes because the blood is clotting more easily. And so we're still early on in our experience with this virus, and we're still learning exactly how it impacts the body and what the long-term effects are going to be. So I would emphasize that even though a young, healthy person most likely will come through okay, there's no guarantee of that, and we certainly don't know what the long-term effects could be.
Definitely. We've been talking about this uptick in cases, and some people have heard, there's an uptick in Florida, and just over this past week. Is this actually affecting our area in Pinellas County? And if so, how's that affecting Dr. Jameson, our EMS professionals? What are they seeing on the ground?
Sure. So it is definitely affecting us here in Pinellas County, and we seem to be really at the peak of where we're seeing the uptick in cases. And there's a lot of us that are very concerned about what it's going to look like here in the next week or two. The reality on the ground right now is that the 911 system and the paramedics are busier than they have been in quite a while. There are lots of sick folks out there, and we're working very hard to take good care of all of them. But we are beginning to see significant increases in call volume. We're also beginning to see our hospitals getting closer to, being full and having their resources strained. And that's a big concern for us as well.
So we've heard the term flatten the curve before, and you're talking about the hospitals. Did we flatten the curve? Are we all done? Or are we in a second wave? What's the actual reality? Are they all good to go and we just have enough hospital beds and nobody should be worried anymore?
I wish. Hindsight is always 20/20 when you're dealing with something like this. But as best as I can tell, our community came together and did an amazing job of flattening the curve. We all sacrificed a lot. We passed up on activities that we want to do. Financially, economically, people sacrificed an unbelievable amount. And we did flatten the curve. It looked like we really got it under control. And unfortunately, over the last few weeks, we have seen that curve rebound. And today, that curve is not flat. It is the opposite of flat. And so all of the concerns that we had going into this a few months ago are now very much in front of us again, and very much a reality again, that we are worried about our hospital's capacity. We're worried about the healthcare workers themselves, and we're worried about what this will do to the health of our community. It may not just be that you get COVID and get sick from that, but if the hospital is completely overwhelmed, well, you may not get treated for your stroke or heart attack as quickly either. And that's a real problem.
Yeah, that's definitely a real problem to think about. Dr. Thogmartin, now that we're talking about these businesses have opened and it seems that we're seeing this uptick, some people though feel that COVID is just fading into the past, like, it was all a hoax or a political game, or maybe it was just the flu and it's just as bad as the flu has always been. Should anyone really be worried? Is it just all a hoax?
Well, I always tell people that I have a brother-in-law that kind of like told me that. And I said, well, don't believe anything I say. Don't believe what you read. Go and pay attention to the overall death statistics. Look at that. Look at various countries, their average 10-year death rates for anything. And if you do that, you'll see there's a giant spike in deaths. So yeah, you could have cases where COVID-19 actually killed people. There's in Florida, he also said, well, these people aren't dying of COVID, they're dying with COVID. It just so happens that they are in the hospital for something completely unrelated to COVID, and because they're positive, they're counted as a death. That is not true amongst my colleagues in Florida. The medical examiners certify in Florida all the COVID deaths. So if there's a COVID death, we'll do an autopsy, an examination, or investigation. And none of my colleagues are just calling it COVID just because they're positive. We go through, we either do an autopsy, exam, or whatever. For the complex cases, we do a very detailed autopsy to try to figure out what's going on. So if you're looking at Florida's numbers, and Florida has the best medical examiner system in the country, if not the world, no doubt about it. More forensic pathologists per capita than any place else. So if you're looking at Florida's numbers of deaths, they are as correct as humans can possibly make them in this world. So when you're looking at that, look at the overall death rates and then look at the COVID numbers from Florida and just watch the numbers. Hopefully with folks like Dr. Jameson and their hard work, they're going to blunt. So there's better knowledge now. We understand the immune storm that people are going through. They have new medications to use, new protocols, and they understand that it's also a clotting disorder, it appears. So they're using anticoagulants. There's all sorts of prophylaxis that are going into these severe ill patients. And I'm hoping it'll cut the death rate quite a bit. But again, you still have strokes, renal failure, heart attacks, neurological damage. So if you have a severe disease process going on, I don't think you're going to walk away the same, but you may walk away.
Wow, that's a lot. This one, is kind of for both of you. What are you personally doing to protect your families now that, we know that it really is affecting us in our everyday lives? What are you doing every single day when you go home or outside going to the grocery store? What are you doing to protect yourself and your families?
I'll let you do that, Angus. You go first.
Sure. So my wife and I both work in the healthcare field, so we both have about the same exposure risk. And so we're not currently staying apart, although I know plenty of colleagues who are apart from their families while they're actively treating patients because they're worried about bringing this home to their families. And I'm sure everybody saw the stories of the doctors who were staying in the RVs parked in the backyard because they didn't want to go in the house. But that's a reality, and it's a concern for the healthcare workers, whether you're a doctor, a nurse, or anybody else that works with us in the hospital. That's a reality, and I think everybody's taking certain precautions. When I go out in public in a place where I'm indoors or can't be socially distanced, I'm wearing a mask. If I'm outside and there's no one around me and I'm in my backyard, okay, maybe I'm not wearing a mask. But if I'm going to be around other people, I'm wearing a mask, and it's important to recognize that mask is not for my protection. It's for their protection. I don't want to be the person that transmits it to somebody else. And so that's number one. And number two is my parents just moved to town a few months ago, right before this all started. And because of their age, they were moving to town to be closer to me and my family. And I have barely seen them, and really not seen them closer than 6 or 10 feet since February. And, that's just the reality of it, because how would I feel if I had an infection with this virus and I brought it home from the hospital And maybe I didn't know I had it. Maybe I was asymptomatic, or maybe I hadn't become symptomatic yet, because you can transmit it in the couple of days before you start showing symptoms. How would I feel if I gave that to my dad or my mom? And they ended up getting very sick or even dying. And the risk is real. I mean, you heard Dr. Thogmartin say what some of those numbers are. The risk is real. So, that's what I'm doing. I'm being awfully careful about where I go, what I do, who I interact with, knowing my risk, knowing their risk, and trying to take everything I can to mitigate that risk. And there's just a couple of main strategies. Nothing's changed from what we were all talking about before. Distance, masks, hand hygiene. I'll add that now inside the healthcare facility, we're also focusing more on eye protection, because the mucous membranes of the eye appear to be a source of transmission. But for out in the community, there's nothing changed. There's no magic bullet, and there's no change in the things that we can do to prevent the spread of a primarily respiratory virus.
Me, what I did I heard about it probably early February. About late February, I was going out in public with some sort of face covering, and it was funny. I was getting some strange looks. The minute it was in Florida, that's when I started doing that. And then right around early March, we had a close call with one of our employees attending a conference in Tampa, that an EMS conference. And,
I was at that conference.
Yeah. He he was volunteering there, and he had basically come in contact with virtually everybody there, and he had become sick. Luckily, it looks like he didn't have COVID, but he did have influenza A and strep throat at the same time. So good news, but that gave us a little reality check. And at that point, knowing that this is a primarily respiratory droplet spread virus, I had all my employees, chemists, DNA analysts, forensic technicians, transport people, doctors, everybody's wearing masks unless you're isolated in your own office. We had no person in the non-public area without a mask, because what would happen is I was worried that we would lose all our transport people, or have to close our entire DNA section, or lose half our physicians during a pandemic because of COVID. So we did that. Also, my family, I definitely was planning on pulling my kids out of school after spring break. Luckily, the schools were wise enough to go ahead and go to digital learning, which was smart. And my children are isolated. I'm isolated. My 86-year-old mother with pulmonary disease has been the earliest adopter of mask wearing in her community, small community in Texas. And that's what you have to do. The thing I emphasize to people is, you can be safe at your home with the people you live with. But if they don't live with you, there needs to be either a great amount of space between you and this person that doesn't live with you, or there needs to be material between you and this person. If there's not, you don't know where they've been. Some of the stories I've heard from various people at work is they're safe when they're running around, like maybe they're healthcare workers and they're nice and safe. They're wearing very high quality masks, but they all go into the break room and they share a potluck together. This is not, when you're talking about infectious disease, talk to an infectious disease specialist and they'll tell you it has to be holistic throughout your entire day and entire week. You can't be safe around patients and unsafe around yourselves. Healthcare workers pooling their children at a daycare. I realize you have to have your kid go somewhere if the daycares are closed, but pooling them together, unprotected. One of your first responders or healthcare workers infects their child infects your child infects you, and we don't have healthcare workers. So we need to be a lot more wise about how to do this. Don't avoid groups and high-risk populations. And if you go in, I'm telling you, if you go into a small building, poorly ventilated, like I did on election day, primary day, and people don't have masks on and they're indoors, I just look at them like they're crazy. That's just crazy, particularly if they're above the age of 65, and which a lot of them were. I thought, oh my goodness. And
but you're both in the healthcare system. You're getting in contact with either had been COVID positive or COVID positive patients, or nursing or doctor staff that have been working with them. And you're going out into the public and being very safe. But what about someone like me that may not come in contact with any COVID patients? Do I need to be just as safe? Do I really need to social distance? Do I need to wear a mask?
I think that if you are at a workplace and there are people there that do not live with you, you need to social distance from them, and each of you need to wear a face covering of some sort, because you don't know where they've been. You don't know how safe they are. They may have a 21-year-old that was recently at all those Pinellas County bars and restaurants, hooping it up, and they may be positive and don't even know it. So in order for us to beat this thing, we need to simulate herd immunity that we don't have by putting space or barriers between every human being that does not share a residence. If we do that, we'll beat this thing.
And
yeah, and I would just emphasize that take a step back and don't think about yourself on this. Think about your coworker who has a family member at home who's on chemotherapy, or has whatever other medical issue going on, or is just lives in a home where there's, an older family member. Think about them for a second. And they don't know you, you don't know them, you don't know who's in their house, but wearing the mask is about protecting other people primarily, and then protecting yourself. So this works best if everybody wears the mask.
Okay, that's a little more clear. I mean, we were just heard you talk about herd immunity, and we need to be wearing masks and social distancing. How are we going to get to herd immunity if we're not all out mingling together?
That's the chickenpox party question. Herd immunity generally is quoted somewhere around 70% of the folks having had the infection. Our number right now is single digits in terms of what percentage of the population have had this infection. Now, there are countries that said, well, we'll just not do this and we'll let it go through and we'll get to herd immunity as quick as we can. And they tried that strategy. It didn't work out too well for them. What they found is they had huge numbers of morbidity and mortality, and they only got to about 10 to 15% before people went, oh my goodness, we got to do something. This is not okay. And so just letting it burn through the population is not a good strategy. And it's not a good strategy for a lot of different reasons. One, some people, and frankly, a lot of people, will eventually get sick and potentially die if we let that happen. Two, the healthcare system will likely become overwhelmed at some point during that when you get one big spike. And then people who have nothing to do with COVID will also unnecessarily die. And three, between here where we are right now and a level of infection in the community that would provide herd immunity is a whole lot of pain and suffering. And that is just not a pathway we want to go down. So the goal is to learn to safely live with this thing, keep infections as low as possible until we can come up with a vaccine. And that way we can skip all that pain between here and herd immunity if we can get that vaccine into folks and stop it.
Yeah, I would agree that we get this novel virus we don't know anything about, has significant morbidity and mortality. You cannot, looking at the numbers, you cannot let it burn through us, because it will be a disaster. It would break us, and it would take us a decade to climb out of that as far as economic damage and just damage to the communities in general. If we can social distance and wear face coverings of some sort and re-flatten the curve and get through it, keep the hospitals from being overwhelmed till about hopefully the end of this calendar year, maybe January. There are 3 or 4 really good vaccine candidates I just heard about with new technology, and they're just amazing, I think. And they are doing in months what usually it takes years. And they appear to be making great progress. Although we have to wait. I mean, the worst news possible would be none of them work. Or I would be happy with a vaccine that just prevented severe disease. I would be happy with that. And I'm crossing my fingers we get that.
Me too, for sure. But I also, like I said before, hope is not a strategy. And this is coronavirus in particular is a notoriously difficult virus to get a vaccine for. We tried during MERS and we tried during SARS, which were also both coronaviruses, and we're not successful. Now, I hope that this time, based upon the amount of resources that are focused on it, that we will be successful. But we need to continue to act as though that's not around the corner. Even if we have one that works by the end of the year, by the time we get, a big enough slice of the population immunized to give us that herd immunity, it's still going to be months. So, we need to be smart about what happens between here and there.
So one of the questions we had on this topic is, what is your suggestion that we shut down until there's a vaccine? And what if we don't? What if we end up without a vaccine?
Those are tough questions. Those are very tough questions. So if we don't get a vaccine, I hope that our backup strategy is that we get medications that can keep it from being a severe disease. And I think we're starting to see some promise on that, but we're not there yet. As far as whether we stay in lockdown between here and there, I don't think that's a viable strategy. Myself, long term, you need certain things functioning in society to keep us all going and to help us mitigate through this. So we need to figure out ways that we can have the economic and social activity that we need to have while still keeping the curve as flat as possible. And there's no easy answer to that question. I wish there was a clear and obvious answer, but there's not. Again, this is a new virus. We've never dealt with this before.
Yeah, I'm in agreement. I think that the lockdown, you can't lock down an economy for that many months without destroying your economy. I mean, you can't. So we just have to be smart. There's, looking at certain businesses, there are certain businesses that are high risk, and those are going to have to modify how they work. Otherwise, they're going to be the epicenter of super spreader events. And those would be, imagine any business that where you go there and you partake of that business's product, and that product has to pass into your mouth, which is food, drink. Those are the things that they're going to have to modify the way they do business. Otherwise, there's going to be spreader events there. And I think that's what we're seeing with our numbers is bars and restaurants, and even their workers are getting sick. They're going to have to up their game while they're serving customers. There's several different ways that would work, but I clearly from the numbers that we're getting and the timing, in my opinion, what we're seeing our surge is bars and restaurants opening. And if you look at they're all, if you're you would not catch me indoors eating in a restaurant with somebody at the booth next to me or families. I wouldn't go to some place and have the place full to capacity. I had bars, restaurants, my opinion on that, I was talking to a friend about it. And if you're at a bar, typically there's a bar or club, there's typical loud music you can't hear. A lot of times actually to compensate for the volume of the music or noise, you're right up in people's faces shouting, what's your hashtag ID? I would say it's COVID-19 and it's yours now too, is basically what's going on. University of Alabama had a big outbreak amongst their football players. I heard from a relative. There's a big breakout in Tuscaloosa because the young people go into bars. Other places similarly are getting outbreaks. So gyms, I think if you're going to go to the gym, trying to work out in a mask is kind of hard, but you're breathing, you're having a hard time, you're breathing deep, you're taking deep breaths, you're exhaling hard, that would be high risk. And then if you go to a church and worship and you're singing hymns or they're a member of the choir, I think that is an extremely high. So you're taking deep breaths and you're expelling breaths. So gyms, restaurants, singing, indoors particularly, are all just going to have to be modified until we get treatments or a vaccine. And the disease is no longer a problem, hopefully.
So I know there's many places, and we're talking about going outdoors, being at different restaurants, bars, or having to do even our essential things like go to the pharmacy or grocery store. Is mask the cure for this? And what's the difference between their thresholds of effectiveness? Should I be getting a bandana? Should I be getting an N95 and be, just as safe as the healthcare workers? What's your recommendation on masks?
Well, the science behind how respiratory particles move between one person or another is really complex. And I've tried to understand it the best I can, but I'm by no means an expert in fluid particle dynamics, which is what it's called. What I can tell you is that a recent publication in The Lancet, which is a very well-respected medical journal, took the best evidence they could find from 172 studies across 16 countries covering 6 continents, and found that distancing and masks are both effective ways to reduce the risk of transmission. Now, clearly, different kinds of masks perform differently, but there's some basic things that you can do to make your mask work as well as possible. So first of all, don't wear it on your chin. Wear it over your mouth and your nose, both of them, all the time. A mask over your mouth while your nose is out is not effective. That's not a good strategy. So you see that sometimes, people walking around with a mask below the nose, or my favorite, on the chin, and that seems more like a fashion statement than protective equipment. So wear the mask and stay apart from folks whenever possible. The risk of transmitting virus one to another in this review of all of this data substantially decreased with every meter you put between you and somebody else. And the risk of transmission substantially decreased if one, and more decrease if both people were wearing any kind of mask. So N95s are sometimes called masks, but really they're respirators, and they're required to be fit tested to ensure you have a good seal, and each one fits a little bit differently. So that's not something that you can necessarily count on in the public unless you've gotten fit tested and have one that actually fits you properly. But surgical masks, the procedure masks with the elastic ear loops, or even cloth masks, all provide some benefit based upon the best evidence we have from these 172 studies across 16 countries on 6 continents.
Yeah, I'd agree. I can show you, I hear a lot of people, well, masks don't work, right? I hear that a lot. Well, I brought some props. This is a mask like what I wear when I perform autopsies these days, thanks to COVID. This is a P100. It has a benefit. I didn't realize that my line of work, sometimes there's odors that are somewhat offensive. I can't smell any of that through this. So this mask clearly is effective for me not getting a respiratory infection. It's a P100. It's going to be great. There's another one called a PAPRS, which is like a positive pressure hood that actually is really effective as well. I don't have one of those. But this, in combination with the face shield, is extremely effective. And however, you'll notice on the front here, it has an exhalation valve. So this mask, if I was to wear at a store, it would protect me from getting infected by you. But if I was infected, out comes my coronavirus out of this valve. So this is for me, not for you. When you move on to others, similarly, this one here is a little smaller. It's a little different. It's got the P100 filter on it. And this mask filters the air that I'm breathing in, and it would also filter the air that I'm exhaling. This is a very effective mask. It's 3D printed, actually kind of cool with the silicone seal. Blocks out all smells and all vapors. I can't smell anything in it either, but it also would protect other people. So if I wore this, I get some strange looks, but I'd probably be the most effective mask wearer in the grocery store.
Yeah.
Then
one of the questions we have is, I mean, you're saying you're wearing different types of masks all the time in your line of work. Are your lungs getting damaged by these masks?
Oh no. The thing is, obviously, if I had chronic obstructive pulmonary disease, I wouldn't be able to probably wear this. It can make you short of breath. I wouldn't want to run on a treadmill in it in the gym. I think it'd be really tough. But these masks are for highly infectious situations like what I deal with. There's the N95 mask that Dr. Jameson talked about. That is also a respirator. You have to be fit tested. You have to be medically cleared, and not everybody can wear those. And there's two types of those. You need to, in my opinion, you need to avoid the ones with an exhalation valve when you're in public. Those would protect you if you were properly fit tested. But every time you exhale, if you're pre-symptomatic or asymptomatic COVID infected person, you're going to be infecting other people. So they do make one that doesn't have the exhalation valve. It's even harder to breathe in, but it would protect others. But if you are bound and determined to wear N95 and you have one with the valve in it, you spent your money on it, you need to wear a surgical mask over the top of it to block that. Otherwise, you're just spreading it if you have it. The surgical masks are effective, it appears. There was a really good, the Lancet study is great that Dr. Jameson mentioned. There's also National Academy of Sciences came out with one that was very good. And it clearly shows that any type of face covering is going to help you not get infected, but it's really going to keep you from infecting others. So again, I approach this kind of like a courtesy. When I'm wearing a cloth mask in the grocery store, I'm doing it for my fellow man, not for myself. And if we had that kind of attitude, I think we'd flatten our curve and reduce it. New York City has done that. They're wearing masks and their curve is going down. They have not had an increase. I think if you can't social distance, you should wear a mask, but preferably you should do both.
Yeah, I agree. And wearing these masks can be uncomfortable. When I am working a shift in the ER, I'm in a mask from the time I walk in till the time I walk out. And it can be uncomfortable. 12 hours straight with one of those things on is not fun. But it's the right thing to do. And it's the right thing to do not only for me, but for the patients that I'm seeing. So I don't want to give them anything, just as I don't want to get anything from them. So, everybody needs to kind of think about this on both sides of that. What are you doing to protect yourself? And what are you doing to protect other people from you?
And one of the comments we just got was, and we talked a little bit about this before, but the curve's already flattened. Why do we need to go out and wear a mask or social distance if it's already flattened?
Well, 3 weeks ago, I would have agreed with you. But the curve is not flat right now. The curve is growing exponentially. It is the opposite of flat right now. There are more people hospitalized and more people in the ICU in Pinellas County than at any point previously from COVID-19. And that's going up very fast.
Our curve is as steep as it's ever been, if not steeper.
It's a hard reality.
Our hospitals tell me that if we don't change something in the next couple of weeks, they're going to be very strained.
Yeah, it's really unfortunate to hear. And I know we all want to take your advice and do the best that we can. We only have a few more minutes left, and I just want to open it back up to both of you for some end comments and, how you're personally doing. How is this affecting you? And what do you really want people to know and go away with about COVID-19 and what you're seeing?
There's a lot there. A lot of us have been working around the clock nonstop for months now, trying to not only take care of individual patients, but also to make sure that we as a community are as prepared as we can be for this. And there was a period a few weeks ago where I was feeling pretty good. Like we had done a really good job flattening the curve. The hospitals had all done amazing work to get themselves prepared and to have plans in place and to be ready for any surge that was coming. And we were sort of sitting going, okay, well, we're ready. Where is it? And I had heard over and over again from my colleagues up in New York about what it was going to look like when the surge came. And they said, well, first you're going to see a week or two of lots of increase in mild disease. And then somewhere around week 3 or 4, it's going to hit you like a wall of people with severe disease. And we all sort of were waiting for that to happen. And it never happened. You know, all through April and May, where is it? When's it going to get here? And we thought we had done this great job, and we did. We did an amazing job as a community. And now, as we've relaxed things and as people have felt, well, it's great, we did a great job, it's all over. Now here it comes. 3 weeks ago, myself and some of the other doctors that watched this closely said, we're starting to see something here. 2 weeks ago, we're definitely seeing something here. We're starting to get worried. A week ago, this is not looking good. And I can tell you, as of this week, our case counts on the daily counts have doubled every 5 to 7 days over the last 3 weeks. And now we're seeing the next lagging indicator, which is hospitalizations and ICUs are beginning to increase significantly this week. And I am really scared that Dr. Thogmartin's work is going to get busy in another week or two.
And I will just pause for a second. One of the things that was brought up that we didn't touch on was, we've had a lot more testing in this area. Are we seeing more positives because we're just testing more? Is that affecting these numbers and what you're seeing? Or is the actual rate of infection going up?
Yeah, I've heard that a lot. And so the thing we've all been tracking all the way through this to compensate for the fluctuation in how much testing is going on is what's called percent positivity. And that means of all of the tests that you did, regardless of how many people you tested, what was the percent of those tests that became positive? And so as we've gone through this, in the beginning, it was really hard to get a test. And then for a while, you could get a test pretty easily. And then, last week, just people, I can tell you, hundreds and hundreds a day at every ER coming in looking to get tested. And so, the numbers of tests have gone up substantially as we've gotten more tests and now more people are looking for tests. But of those looking for tests, we've gone from 1 or 2% of them coming back positive to a much higher percentage coming back positive, 10, 15. Some testing sites have told me as high as 20 or more % of the tests they're sending are coming positive. So the number in our community as a whole is in flux for sure. But it's substantially higher than it was just a week, 2 weeks ago. And so I don't think that you can explain away the increased cases based upon the increased testing. And I certainly don't think you can explain away the increased number of patients in the hospital, the increased number of patients in the ICU, and the increased number of people that Dr. Thogmartin is seeing come through his office based upon testing. I think that that's a false argument. It may explain some of it, but it surely cannot explain the fact that there are more people in the ICU today than ever before from COVID in Pinellas County.
Yeah, I agree. There's not much I can add to that. The thing is, we can't experiment. You can do randomized controlled trials of treatment and prophylaxis and vaccines when we get candidates. But with this type of disease in the community, you're relying on empirical evidence. What are you seeing? What is the hospital seeing? What are we seeing? What is our experience? And I think unequivocally that this is not increased testing causing this. This is increased numbers of positives, increased percentages, and even the demographic of positives are changing. So I think that, some mistakes were made amongst our, fellow citizens with their personal choices right around Memorial Day. I think that we need to remember that it's not gone and it's not fake, and you can ignore reality, but you can't ignore the consequences of ignoring reality, right? Someone said.
Well, I really appreciate you both for taking this time with us. I know there was a lot of questions we still didn't get to, and we'll try to answer those in the comments. And I know there are some specific numbers and data that we weren't able to get to either, and we'll try to answer those as well. Thank you guys so much for being with us, and hopefully we can do this again or get some more information for you guys. Really appreciate it. Thank you.
Thank you.
Thanks.